I'm Marinus Mans, and welcome to the Muscular Dystrophy Foundation of South Africa's YouTube channel. If you like the content, just click subscribe. If you like the video, just hit like. I'm here with Andrew Miller today. He is a novelist, a brand strategist, and commercial ghostwriter with over 20 years of experience. He's also a regular public speaker and a freelance journalist, and he also volunteers from time to time with the MDFSA. Andrew was diagnosed with spinal muscular atrophy, or SMA, type 2 in 1977 at the tender age of 3 years old. And because this month is SMA Awareness Month, I've asked Andrew just to help us make sense of the current status of SMA treatment in South Africa. Welcome, Andrew.
Hi, nice to be here.
Thanks. Always good to see you.
Always good.
Can you, just for those people who don't understand what SMA is, can you briefly explain it and how it affects you?
It's a genetically inherited condition that results in a malfunction in what they call the anterior horn cell, which is a particularly important sort of adjunct to the spine that sort of controls a lot of the communication between the spinal cord and the muscles. And the malfunction means that an SMA patient doesn't have a lot of what they call survival motor neuron protein. And that protein is essential for muscle development. And so people with SMA either have very poor quality muscle, or in severe manifestations of the condition, the muscle's actually atrophying and dying. So, when infants are born with the severest form, SMA type 1, historically, they've often died before 15 months old. And then there are various other forms. I've got type 2. It goes all the way through to type 4. And the rule of thumb in the old days used to be the later you're diagnosed, the better the prognosis. All of that has kind of changed, but that's still a good general rule of thumb. And it means in severe conditions, a lot of people are living in motorized wheelchairs and really struggle with basic movements, as with all neuromuscular disorders. And then there are more benign kind of manifestations. And so a lot of people with type 3 or type 4 will still manage to stay walking to a degree with assistance, et cetera, et cetera. And in my life, I've been lucky in that the manifestations, even though I was diagnosed very young, didn't kick in until I was quite a lot later, until I was quite a lot older. Like 15, it really started to kick in for me. And so I've managed to stay upright to a degree. And yeah, as you know, living with a neuromuscular disorder is like an extreme sport. Yeah.
It's a very expensive hobby.
Totally.
You've done some research about the different treatments for SMA, because unlike some of the muscular dystrophies, especially mine as well, there's no treatment available. But with SMA, there are treatments available. But also, you've looked at the regulatory framework in South Africa, the policy issues in South Africa as well. And I wanted to ask you, how far behind the rest of the world, the developed world, are we with these issues?
I think we're very far behind. There has been with SMA recently, one of the 3 treatments on the global market has been registered as a medicine in South Africa. So that's a huge step forward. But in my view, it's almost accidental. In the broad realm of what we're calling now genetic treatments, genetic therapies, we're very far behind. These are new modality treatments. It's a new way of kind of looking at medicine. It's not chronic care and it's not emergency. These treatments that are coming out for SMA and other rare diseases work at the genetic level. And overseas in the developed world, what you're seeing is enormous price tags for these genetic treatments. But you're also seeing a willingness and an ability from governments and medical aid funders and patient advocacy groups to get around the negotiation table and hammer out pricing agreements. In South Africa, we've just seen none of that, and even though this process is theoretically underway, we've got so many complications as a society, and money just being one of them, it means that these treatments for SMA came out internationally 6 years ago, the first ones. And the one has been registered as a medicine. There's no sign of any of the other two arriving anytime soon. We could be a decade or even 15 years behind the rest of the world when it comes to the other two treatments. So we're a long way behind.
Was there any communication to SMA patients from international bodies or our government health officials when those treatments became available?
As far as I'm aware, and I've done a lot of research and interviews, I haven't seen a single piece of formal communication from any stakeholder to SMA patient groups in South Africa. Not a single one. And so patients on this side of the world are kind of just left in utter darkness in terms of understanding what the likely path is to treatment access. And so a lot of the pain and anxiety and anger and trauma around the treatment access actually revolves around a lack of information in general, not just the long path to access, but the fact that there has been no communication at all from any of the stakeholders. And I think I've said to you before, I kind of put it down to thoughtlessness. Our little patient group in South Africa of SMA people is, I think, registered people is 78. We know from the numbers that there should be about 1,000 people registered in South Africa with this condition, but our diagnostic capacity is so small that we've registered so few people that we really are an afterthought. When you've got 78 people, no one's really taking your interests as a group hugely seriously because your voice is very small. Yeah.
You sent me a draft article that you're going to publish, I hope.
Yeah.
And in this article, I read that you mentioned the videos that you watched, presumably on YouTube, about where they show the SMA patients being treated with these drugs. And here you are in South Africa, and you have no access to those drugs.
Yeah.
How did you feel? I mean, I would be, if I were in that position, when I know there's a treatment available, I would do so many emotions that I can think of right now. How did you?
It's an extraordinary thing. The first one I saw, was of a child who was diagnosed with type 1. And so theoretically, type 1, most kids don't live past 15 months. And the video is of her at 3 or 4 years old in the doctor's office, running around doing push-ups, happy, playful push-ups. So it's an extraordinary thing. But, like in a lot of ways, mentally, it's simpler to have an untreatable condition than it is to have hope, right? Because an untreatable condition is a very simple thing. There is no hope. There is no treatment. On you go. Whereas suddenly hope arrives and all sorts of mental gymnastics start happening. And it's actually quite difficult to get your head straight about what you hope for yourself, for your future life. Because you know that these treatments are there, but you also know that they're not available in South Africa and that there may be a very long drag before they are. So I found it extremely complex to kind of manage my mental machinery around this paradigm, but I'm an old dog. I've had a relatively benign manifestation of this condition. I can't really imagine what it's been like for families who have small children with severe manifestations, where time is very much of the essence and where you're watching your child waste away physically very quickly in some circumstances. In that paradigm, it must be an extremely difficult thing to keep on watching the West. And because, our internet world has given us high transparency in the third world, we see everything that happens in the Western Europe and Australia and so on, but it's extremely opaque in the other direction. They see very little of us. And their concern is not really of what's happening in South Africa. And so these videos go out with a lot of joy and hope. And a lot of people overseas are talking about mixing the treatments and always reporting on the profound sort of strength that they're gaining and so on and so forth. It's quite obvious to me that a lot of them have never thought about the fact that there are people in other parts of the world watching these videos in a kind of a highly tortured way. Yeah.
No, I'm with you.